Good afternoon. Welcome. We're going to get started in about 5 minutes. Thank you. All right, good afternoon. And again, welcome to everyone. Today, we're going to have our first public meeting for 2020 on electronic visit verification. Thank you again for joining us, and everyone, Happy New Year. Just to go through, having some technical difficulties, I apologize. All phone lines are muted as our usual protocol for public meetings, and the questions should be submitted through the chat feature, and we will address as many questions as possible at the conclusion of the presentation. Also wanted to let you know just up front that we do not have anyone from SanData participating at today's public meeting, but you can still submit any technical questions through the chat feature, and we will be sure and collect those and send them to SanData for follow-up after the public meeting today. So again, you can submit questions that are relevant to SanData, and we will make sure that Sandata does receive them, and we will respond directly to you with that information. So just some general EVV background, which we've covered in previous public meetings, but it does bear repeating. Section 12,006 of the 21st Century Cures Act requires all states to implement the use of EVV for Medicaid-funded personal care and home health care services that require an in-home visit. Again, this is a federal mandate, and Pennsylvania is doing everything we can to implement this. EVV must be implemented for personal care services, or PCS, by January 1st, 2020, and for home health care services by January 1st, 2023. Since personal care services need to be implemented now, personal care services is our focus at this point when we are talking about electronic visit verification. As many of you are aware, CMS did provide the opportunity for states to apply for a good faith effort exemption, which would allow for up to a year of additional time for EVV implementation for personal care services. Pennsylvania did apply for the good faith effort exemption in November of 2019, and we did receive the approval of that submission. The CMS approval allows providers additional time to use EVV without impact to provider payments, but providers are still expected to implement and use EVV now. As of July 1st, 2020, provider payments will be denied without corresponding EVV data.
Just to clarify, we've had some questions come in about how that EVV data comes in. It is not something that the providers submit on their claim. Their claims data stays the same. Our claims system will be checking our DHS EVV aggregator to determine if there is a visit on file that matches the data on the claim. So it doesn't get submitted on the claim. Our claim system is checking the aggregator on whether or not the visit data has been received for that visit.
And just an additional note on the GFE, or the good faith effort exemption application itself, we've had a number of requests for a copy of the application that we submitted to CMS. We will be posting that to the DHS EVV website, along with the approval letter that we received from CMS. We are currently working on some updates to the DHS EVV website, so hopefully that will be live next week. But again, in our request to CMS, we were seeking an extension to July 1st of 2020. So in light of the good faith effort exemption that we received, DHS then allowed provider agencies to submit extension requests by February 1st, 2020, if they did not think they would be EVV compliant by March 31st, 2020. If you have not submitted an extension request to date and do not think you will be compliant by March 31st, please do so as soon as possible. Submit that. The extension form is available on the DHS EVV website, and you should submit that through the EVV resource account, which you'll see later in the presentation. To date, DHS has received approximately 240 requests from provider agencies. The #1 reason for delays noted in those requests is alternate EVV integration. Most submissions noted a date of April 1st, 2020, that they believe that they will be compliant, even with the existing delays that they're experiencing. And all but 3 provider agencies identified that they would be ready no later than July 1st, 2020. So the DHS Sandata EVV system is live. It went live in October of 2019. The system is free and available for use by fee-for-service providers. And if fee-for-service providers are intending to use the system, they must take the online training and receive a welcome kit, which will provide their access to the system. But as you all know, we are using an open model, and alternate EVV systems are accessible. Providers may use their own. And the only caveat is that they must be integrated with the DHS aggregator no later than July 1st, 2020 for provider agencies to be compliant. And we want to just put a reminder out there that just because you are currently using an EVV system, that does not mean that you are compliant. EVV compliance includes integration with the DHS aggregator. DHS needs to be able to see your EVV data in the aggregator. As I previously mentioned, we are using the open model, so providers are able to use their own EVV systems or alternate EVV. The alternate EVV systems need to capture the 6 required items under the 21st Century Cures Act and must meet DHS system data requirements to integrate with the DHS aggregator. The technical specifications may be found on the DHS EVV website, and the link is included there. Another note is that the presentation for today will be provided on the DHS EVV website, and we will make sure it is sent out to all participants today. So we have had a number of issues related to the alternate EVV certification process that have been mentioned to us. We just want to make sure that fee-for-service providers utilizing an alternate EVV system, you need to know that you have to contact the Sandata alternate EVV support team in order to be certified and integrate with the DHS aggregator. The contact information is that phone number and email that is included on the screen. And we wanted to make sure that you understand that the certification process can take several weeks depending on the testing required.
In addition, if you're a provider agency that is intending to use an alternate EVV system and you have not reached out to the Sandata alternate EVV support team yet, when you do initially outreach, the provider agency must do the initial outreach, not your vendor. We need to make sure that the agency is basically authorizing that system to be integrated. So your agency must do the outreach initially, and then your vendors can get involved later working with Sandata.
It's important to note that when contacting the Sandata alternate EVV team, detailed setup information is required, including what systems are used to collect EVV data. Any missing information may lead to additional delays for the Pennsylvania EVV program compliance. And the Sandata, again, the Sandata alternate EVV support team can be reached by phone at 855-705-2407 or by email at paaltevv@sandata.com. Again, that's included in the presentation. So who needs to be certified for the DHS aggregator? A provider supporting only CHC MCO participants using the HHA exchange system does not need credentials for the DHS aggregator. A provider supporting only fee-for-service participants, yes, credentials are required for those that are using alternate EVV or a non-Sandata system. And lastly, a provider supporting both CHC MCO and fee-for-service participants, those providers, if all their visit data is captured via the HHA exchange system, they do not need to be certified. However, if they're using alternate EVV systems or capturing visit data in multiple EVV systems, then yes, they do need to be certified and take the training for the DHS aggregator. We just wanted to reiterate again that alternate EVV aggregator training is not mandatory for CHC providers using HHA exchange only. This is a question that we have received a number of times in the resource account, as well as we could identify that in some of the extension requests we received from provider agencies. So we wanted to make sure, again, that those providers that are using HHA exchange only, you do not need to reach out to the alt EVV support team. And CHC providers electing to use the HHA exchange EVV system offered by the CHC MCOs must work with the CHC MCOs to complete training and any other onboarding requirements. So again, you do not need to reach out to the Sandata alt EVV support team. Additionally, providers already working with Sandata through the alt EVV process do not need to reach out again. This is really only for those provider agencies that are using an alt EVV system and have not already reached out to start that process. And again, HHA exchange users do not need to reach out to the alternate EVV support team if it's CHC only purposes. We wanted to once again go through the alternate EVV certification process. That first step is that the provider makes the request to SANDATA alt EVV support via email or phone. Then the second step is that the provider receives the alt EVV system information. Step 3 is the provider takes alt EVV training on the SANDATA aggregator, and that's through the learning management system. Step 4 is when the provider requests testing credentials. And we think that a number of providers are getting hung up between step 3 and step 4 because you're not realizing that once you take the training, that there's additional steps that you need to take. But please know that the training itself is essentially the beginning of the testing process. So, step 4 then can begin after that training concludes and you receive your certificate from the training. So then after step 4, when the testing credentials are requested, step 5 is the provider works with SANDATA to conduct the testing and assist with any issues or errors encountered. Then move into step 6 for the provider to identify go live date and then request the production credentials. Step 5 is when the provider confirms the live data is in the SANDATA aggregator. And then step 8 is the notification of the provider alt EVV completion. So this is the entire process. And as you can see, it is an extensive process and can take a number of weeks for this to occur. So alternate EVV testing, the SANDATA alternate EVV system is available for testing at all times except during standard release windows. SANDATA can assist with testing results and validation. The participant matching will not be included as part of testing, but will be enforced in production. And as I mentioned earlier, duration of testing varies from 1 week to 4 weeks. Testing should continue until the data sent is error-free. So please monitor your email for updates from SANDATA, including checking your spam folders. And once testing is complete, SANDATA encourages the move into production as quickly as possible, since the mandatory use is now for EVV. If a provider is using both alternate EVV and the DHS SANDATA EVV system, please let SANDATA know by contacting the SANDATA alternate EVV support team by phone if you haven't already done so, or by email. Just an overview of how many alternate EVV systems we currently have in the pipeline. Alternate EVV systems currently testing, we have 138. Alternate EVV systems with testing completed are 21. The alternate EVV systems in receipt of production credentials to date is 69. And the alternate EVV systems with confirmed data in the DHS aggregator is 14. We're sure that that number is going to increase in the next few weeks. Wanted to once again just show you, what we're talking about when we're talking about the DHS aggregator, since that is where all the EVV data is going to be funneled for DHS to access. So as you can see, the CHC MCO's EVV system, HHA exchange, is feeding into the aggregator, as well as the DHS SANDATA EVV system, the fiscal employer agent alternate EVV system, and the alternate EVV systems. They're all feeding into that aggregator. So I know that we've gone over this in the past as well, but it bears repeating since we do continue to receive some emails in the resource account regarding, what are the EVV services that are covered right now for implementation. And for ODP providers, The fee-for-service providers are those under Consolidated Person Family Directed Support Waiver and Community Living Waivers and Intellectual Disabilities Autism Based Services and Adult Autism Waiver. The DHS mandated EVV system is available for fee-for-service providers who do not have their own system. And fee-for-service providers choosing to use alternate EVV systems will need to work with Sandata to get their system certified and receive production credentials. For participant-directed services under ODP, PALCO will be using an alternate EVV system called Authenticare, and ODP will communicate out additional information once we have it available. For OLTL providers, fee-for-service providers are under the OBRA waiver and Act 150 program. The DHS aggregator will receive information from alternate EVV systems being used by providers in fee-for-service programs, and providers should contact Sandata through the alternate EVV support team for any integration activities for fee-for-service programs. Also under OLTL providers, we have CHC, of course, and the 3 CHC managed care organizations are utilizing HHA Exchange for EVV. Providers using alternate EVV systems in CHC will need to send their EVV data to the CHC MCOs. Providers should contact HHA Exchange at the email included here to complete third-party system integration activities for CHC. And questions about HHA Exchange should be directed to the CHC MCOs. Also under OLTL, we have the participant-directed services, and OLTL's vendor fiscal agent public partnerships LLC or PPL is using an alternate EVV system. It's called Time for Care. This system is already integrated with PPL's timesheet and payment system, as well as their participant and direct care worker online portals, and the training began in August. So this is a little bit of a repeat, but you know, what we've just covered, you know, the fee-for-service programs are those that are listed out here under ODP and OLTL, and then separate from that, we have the CHC program. For any questions on whether a provider or services are included in the current EVV mandate, please contact provider enrollment. And we have the ODP provider enrollment listed here with the 800 number, as well as the resource account address, as well as OLTL's provider enrollment with the 800 number there as well. So we've had a number of questions regarding manual corrections in the system, and we want to make sure that providers know that manual corrections should be done on an exception basis only, and in situations when all electronic options are unavailable. Manual corrections in EVV are accepted, but should never be the primary source of visit capture information. And supporting hard copy documentation should be kept for any and all manual corrections. Even if a visit is captured electronically, but an exception sets and is corrected, the record would be classified as a manual correction. And EVV compliance regarding manual corrections is still being discussed internally, and we will share updates in the future through the release of a bulletin. We mentioned these in the previous public meeting, but we wanted to make sure that everyone is aware that the edits for ODP fee-for-service went into effect for claims submitted beginning November 1st, 2019, for dates of service November 1st, 2019 and after. Additionally, edits for OLTL fee-for-service went into effect for claims submitted beginning December 13th, for dates of service November 1st, 2019 and after. We got a little bit of a mix-up here. I apologize, but just to go back a little bit, the DHS aggregator does not submit claims. When an EVV service is on a claims transaction, the claim is validated against EVV visit data and the DHS aggregator. And we wanted to make sure that you understand the billing processes continue as normal. But back to error status codes, you know, the ESCs for fee-for-service may be found on the DHS EVV website, and we're also sent out via the listserv communication. The error status codes 925 through 931 are EVV edits. They are not Pyxis codes, and providers should not be adjusting claims based on these EVV edits. The paid status claims needing corrections should be voided and then resubmitted. If an EVV record in the DHS aggregator is in any status other than verified or processed, it will fail EVV validation. All records should be in verified or processed status in order to be validated against. Any other status will set error status code 928, which is EVV record not found. So again, it is imperative that you are going in and verifying your EVV data. EVV claims inquiries should be made to the appropriate program office for assistance. We've included here the ODP claims resolution section, you know, that contact information, as well as the OLTL provider call center. And if there is an EVV system issue, please contact the PAC line, and that's the phone number and email is included there as well. So just a reminder that it is the provider's responsibility to train staff and provide assistance to employees having difficulty using EVV. Providers should be capturing and verifying EVV data, as we mentioned earlier. Providers need to review their remittance advice to monitor claims to identify issues that need to be addressed. And visit exceptions need to be resolved by the provider. And providers in ODP-based services also need to review ODP files to identify issues that need addressed. Another important note is that you should not be entering training data or dummy data into the EVV system. It is live. Providers should only be entering production data EVV visits at this time. Online self-paced training is available 24/7 for providers using the DHS Stand Data EVV system. And the DHS EVV webpage includes videos of the DHS Stand Data EVV mobile app and telephony to demo the visit capture methods in case anyone is still curious about which system to use. For the DHS Stand Data EVV system, which is the free system that we are offering for fee-for-service providers, who needs credentials, which gives you access to the Stand Data portal. A provider supporting only fee-for-service participants, the credentials are required for those individuals that are using the DHS Stand Data EVV system, but they're not required for those that are using alternate EVV systems. A provider supporting both CHC, MCO, and fee-for-service participants, if all the visit data is captured via HHA exchange, as mentioned previously, then no, you do not need credentials. But if visit data for fee-for-service is captured in the DHS Stand Data EVV system, then yes, you will need credentials to use the Stand Data system. And there are two types of trainings in the DHS Learning Management System once providers go in to access the system. So please be certain to attend the correct training for your agency needs. The first one is the Alt EVV or Alternate EVV self-paced training for the aggregator access. And again, those are using an EVV other than DHS Stand Data EVV, so an alternate EVV system user. And there's only one course module accessible for that training. The second type of training is the DHS Stand Data EVV training, and it's for administrators who need to complete the EVV self-paced training for agency providers. Again, this is for agencies using the DHS Stand Data EVV system, and we want to make sure that you understand that you'll need to take all 23 modules, which are, each module is approximately 5 minutes each, before that training is completed and you can receive your welcome card. If your agency still needs DHS Stand Data EVV credentials, Be sure you complete all the trainings necessary. Please contact the PAC support line for assistance with any training questions. The phone number or email included here. I wanted to note yet again that alternate EVV aggregator training is not mandatory for CHC MCO providers using HHA exchange only. And the DHS San Diego EVV system self-paced training is available for providers electing to use the DHS San Diego system for OBRA, Act 150, and ODP programs. I wanted to be very clear about who should be using the San Diego system and who can use the San Diego system. Providers using the DHS San Diego EVV system must complete training in order to begin setting up their agency accounts and security permissions. When enrolling for the DHS San Diego EVV system training, please be sure to use only your 9-digit agency Medicaid provider identification, or MPI number. It is important to note the following inhibits and delays reporting and welcome kits when providers use inaccurate MPI numbers, use more or less than 9 digits in the MPI number field, or use faux MPI numbers, such as 11111 or 1, 2, 3, 4, 5, 6, 7, 8, 9. Please do not do that. So the welcome kit is sent out once providers do complete training, and it's sent via email and will contain the following information. It's an encrypted welcome letter containing important next steps and instructions for using EVV, including the agency-specific login credentials, which includes the URL, username, and temporary password in order to access the San Diego EVV database. The login credentials contained in the welcome kit will also allow the agency to input their direct care workers, as well as set up additional agency-level staff to view and manage EVV data. 2 agency-specific call reference guides containing Santrac's toll-free phone numbers are also included. One of the call reference guides is for group visits, and the other is for non-group visits. These call reference guides contain step-by-step instructions on how to check in and out using this telephonic visit verification. The other item that is included in the welcome kit is the services list. So while multiple provider representatives from the same agency may complete the DHS San Diego EVV training, the welcome kit email will be emailed to the first identified provider agency representative email addressed on the training registration and completion report. When agencies receive the welcome kit emails, they should begin to enter direct care workers into San Diego EVV, add agency EVV users, and become familiar with training documents and train employees. Partial contents of the welcome kit email are encrypted. When the welcome kit email is sent by San Diego, the recipient will have 10 days to open the email. Once opened, the recipient will, once opened, the recipient will have 10 minutes to access the code to open the secure content. It is important to open the welcome kit email timely to avoid requesting it to be resent. If you are a fee-for-service provider and have completed training but have yet to receive a welcome kit for your agency, please contact the PAC line at the 800 number or email included here. Just another reminder to check your spam or junk folders for welcome kits and or your login credential emails. And if the welcome kit has expired, again, call the PAC line to get the welcome kit resent. I know that we've mentioned this a number of times, but the DHS San Diego EVV system is only available for fee-for-service providers. The self-paced online training is still available for new providers or providers wanting to take refresher courses. The registration link is included here, and it is also posted on the DHS EVV website. date, 527 unique provider agencies have completed training and received welcome kits. If you are a provider that is new to EVV and do not have a provider ID, please contact your program office or the PADHS resource account for information and requirements. And the resource account address is listed here, ra-pwevvnotice@pa.gov. So some reminders about the system. All state clients that import from the state will populate EVV databases in pending status. It is important that agency users with appropriate security access change the status to active. In the visit maintenance, by clicking on a particular visit and then clicking the GPS tab, this screen shows the location via map on the Sandata Mobile Connect call-in, call-out time relative to the client's home. A GPS exception is an exception that is acknowledged, not fixed. A GPS exception report contained under daily reports provides the distance exception in footage on a particular day. And as far as the active client report, you should use this report to view all client phone numbers, active addresses, identify whether or not an address was verified by GPS, the Medicaid ID for Sandata Mobile Connect, the client ID for telephonic, and the custom ID field for cross-reference. Using the Sandata Mobile Connect application requires the direct care workers to enter a Medicaid ID or client ID for the client they are providing service. The Medicaid ID or client ID can be found on the active clients report under the daily reports. This information is also available under the specific client in the clients tab. The client ID is generated by the Sandata EVV system and does not contain PHI information. For security reasons, DC or direct care workers are not able to search by client name. I think that's a repeat, so. Just a note on the DHS Sandata EVV system, because we did mention this at the last public meeting, and we have had a number of questions about it, but the billing module within the DHS Sandata system is not yet activated. However, it will be forthcoming. Hopefully we can share that at the next public meeting. And during this time, we encourage providers to take the DHS Sandata EVV scheduling and billing training in the learning management system if you are interested in those modules. Additionally, the 2-to-1 group visit logic is currently in testing, and we will provide an update on that as soon as we are able to. Again, we wanted to remind you that your DHS Sandata EVV account is live data and should be used only for actual visit information. Contact information. This is a question that we get a lot. For DHS Sandata EVV application questions, you should be calling the PAC line or emailing them. DHS aggregator issues should be reported also to the PAC line. Again, that phone number and email is listed here. And then for EVV general program questions, please email the resource account, which is listed there. And just general contact information or important points when you're reaching out to any of these entities. The more information we have, the better we can assist you. Not all caregivers operate the same, so please be as detailed and descriptive as possible so that we understand your issue to the best of our ability. If you are working with a vendor and have a case number, please provide the case number. This is extremely helpful for us. If you have specific examples or screenshots, always send those securely due to PHI. And again, check your spam folders regularly for emails from DHS, Sandata, HHA Exchange, or other approved listservs, programs, or agencies.
if you're contacting the Provider Assistance Center or the SANDATA Tier 2 or Tier 3 team, and you have not received a ticket number, please request a call reference number. This helps us if we should ever need to be involved with assisting you and following up with these entities and, you know, logging what that conversation was. So please request a call reference number if you did not receive a ticket.
And again, as we mentioned previously, we are working on some updates to the DHS EVV website. We did mention this in the previous public meeting, but we do have a new website linked for the DHS EVV website. It is included here, and additional EVV communications will be posted to the DHS EVV website and will also be sent out through the listserv. Now, we just wanted to address some common questions that we have received through the PAC line. The first is, do I need to register for all EVV if I am only using HHA Exchange? I know this sounds very familiar to everyone now. If your agency is using HHA Exchange for CHC only, alternate EVV is not applicable. HHA Exchange will submit all visits for their agencies. Can multiple login credentials be issued for agency staff? No, only one set of login credentials are issued per agency. The selected administrator will have the ability then to create staff as additional users. Another question that we received is, I am trying to log in to the aggregator and receiving an error message. Please advise. So the solution to this is on the home screen to log in, please leave the agency field blank. And you'll see that we've included a screenshot here of what that will look like. And that top form is the agency box. So please leave that blank. Another question that we have received a number of times is, I'm not seeing all the calls my caregiver advised they made in the SANDATA EVV. And to see this, you need to click on a visit row in the visit maintenance to view the visit details box. And all telephonic or SANDATA Mobile Connect entries will be displayed in the call log. A visit row, however, only displays a maximum of 2 entries. When extra calls are made by caregivers, they can be viewed in the call log section within the visit details box. These extraneous calls are referred to as interim calls. The interim calls are not displayed in the visit row. This can happen when a caregiver makes too many calls within a few minutes apart. The last entry will be displayed in the visit row. So we have an example here that is included below in the snapshot, which shows a caregiver that made 2 SANDATA Mobile Connect entries within a minute apart, one at 9:27 a.m. and another at 9:28 a.m. Only the 9:28 a.m. entry will display on the visit row in visit maintenance. Another question that we received multiple times is, can agency SANDATA EVV users delete a visit in visit maintenance? No, SANDATA EVV users cannot delete a visit or in visit maintenance once it has been recorded. However, agency users with the appropriate security roles and privilege may mark a visit row as do not bill.
There is also an omit status that can be utilized to change the visit to omit, meaning it's not going to be billed for and it's an invalid visit.
Another question we received is, if a caregiver forgets their SANDATA Mobile Connect password, do they have to contact their agency? While an agency SANDATA EVV user can reset a mobile user password, caregivers may also click on the Forgot Password on the login screen of the application to have a temporary password sent to them via email. Another question that we received is how to view all the visits in visit maintenance. And the response is, in visit maintenance, ensure the filter visits by is set to all visits. to see all visits, with and without exceptions. Another question we've received is, does the DHS San Diego EVV system allow for the manual entry of clients? And there is no manual data entry of clients directly into the DHS San Diego EVV system. All DHS clients are sent via a state feed and uploaded into DHS San Diego EVV. If a client is missing in the DHS San Diego EVV system, what is causing this? So a missing client in the San Diego EVV system may be attributed to having an inactive service location on the authorization in HCSIS. In order for this to be corrected, an agency representative should contact the supports coordinator to have them associate the authorization with an active service location for the client in order to load the San Diego EVV system. Another question we received is, what is a location device code? The location device codes are associated with fixed visit verification devices, which are used by caregivers when there is no client phone to use for telephonic visit verification or caregiver's cell phone for San Diego Mobile Connect. This functionality is not part of the DHS program at this time. Another question that we received, and this came up during the last public meeting as well, is how does a client date of birth get captured in the San Diego EVV system? San Diego and DXA are working with DHS on having client dates of birth received and populated in agency databases. So we are working to address that. Another common question is there any way to change how many days caregivers can view past visits in San Diego Mobile Connect? Currently, they can only view past visits for the last 5 days. And this is currently a DHS-approved setting across all counts. However, we will consider this and other suggested enhancements in future system releases. So please continue to bring these items to our attention. And another question that we received in the last public meeting and have received since then is, why are the San Diego EVV users only able to adjust visits within the past 14 days? And thank you again for bringing that up to our attention. We did work with San Diego and DXC to make the changes to 365 days in order to align with our existing business rules. An additional question is, can you use San Diego's EVV billing and scheduling components if you use an alternate EVV system? And unfortunately, no. If an agency is using an alternate EVV system, they will not be able to use the San Diego billing or scheduling components. And another reminder that DHS is currently reviewing the EVV data that is being funneled into the DHS aggregator. Providers should not be changing start and end times. We want to capture the true start and end times of the services that are being provided. Providers selecting other for reasons for their manual edits should provide written reasons for selecting this option. And this has been mentioned previously as well, but the IVR technology clarification from CMS is that telephonic verification must include validation through a GPS or location system. Cell phones are not acceptable for telephonic verification unless a location device code is included. Fixed voice over internet protocol or VoIP is acceptable, but non-fixed VoIP will require a location device code. And one final point is providers must ensure the EVV system being used by their caregivers meets the federal requirements, which includes the capture of location. And finally, DHS will be sending out a survey in the near future to provider agencies requesting information about which EVV systems the provider agencies have elected to use. So please be on the lookout for that communication in the next week or so. And please be sure to complete that so that we have that information on hand. With that, we will go to questions that have come in during the presentation.
So we received quite a few questions about the HHA exchange system being used by CHC MCOs in the Community Health Choices program. And one of those questions was if we can elaborate a bit more on what we mean by HHA exchange and the MCOs. So Community Health Choices is the managed care program for Office of Long-Term Living waivers. And the program, it operates with managed care organizations. Those managed care organizations have selected an alternate EVV vendor called HHA Exchange, and that can be used for the managed care waiver, the 1915C waiver for EVV compliance. With that being said, HHA Exchange is the MCO's system, and there are a lot of questions here about the HHA system, functionality, issues that providers are having with the system. If you're having issues or you have questions about the HHA system, you have to reach out directly to the managed care organizations that you're contracted with, as they are the ones that are operating the system. Another question we received is an extension form necessary if the provider is using the SANDATA DHS system? Since it is expected that providers begin using EVV, if you are unable for some reason to begin using the SANDATA EVV system, it would be very helpful for us if you submitted additional information via the extension form so we can have a better understanding of the delay. Another question we received, when we refer to alternate EVV systems, are we referring to third-party applications? And yes, we are. We're referring to any system that is not the state-offered SANDATA system. Another question, we received quite a few questions about manual entries for visits if the system is not working correctly. So if a direct care worker, for whatever reason, is unable to log into the system or is having system issues that's preventing them from logging their time, providers can always go back and manually enter that information. That being said, it is expected that providers maintain hard copy documentation when this does occur, and providers are allowed flexibility in deciding how they want to establish that policy as long as they are maintaining that documentation. A question here is, what if SANDATA and the DHS aggregator are unable to complete all processes by July 1st? If we were to encounter any sort of delays that would not enable us to be compliant by July 1st, we will release additional information on a backup plan in that scenario. But at this time, all progress is moving forward at a proper pace, and we don't anticipate that being an issue. Another question here is regarding whether or not providers will be penalized for editing or adding time due to system issues. So any manual edits or manual entries to time for EVV should always be a backup. That should be a last resort and only done when necessary. But you will not be penalized for needing to do so. However, in the future, we will be releasing a bulletin. It will be a joint OLTL outline expectations in relation to the frequency of manual edits. We do intend to tier the expectation of manual entries over time. We'd like to see providers improve upon that activity over time, but we do want to be flexible as well, understanding that manual entries will always be necessary as things happen throughout the day. So please keep an eye out for that bulletin in the future. With that, we're going to gather some additional questions, so please just bear with us. additional question we received is how do providers gain access to the listserv? If you would like to subscribe to the EVV listserv, please send an email to the RA box. Previously mentioned, I'm not sure which slide it was on here, but you can send an email asking to subscribe to that to the RA box for EVV. Oh, there it is at the bottom of the screen. Next question, will the aggregator generate an exception if the number of hours submitted for a visit are greater than the number of hours billed in a claim? So if you have EVV visits in the aggregator and then you submit a claim for more units than were registered in the EVV system, as of July 1st, that claim would deny. At this time, there will be an error service code that will generate showing that there are not enough EVV visit data entries in the system to accommodate all of the claims billed. So you should make edits and changes as necessary when you receive those error service codes. Guidance for the error service codes that may populate for EVV are listed on the DHS EVV website. There's a few questions regarding a mismatch in EVV information and authorizations not matching what is approved or established as eligible in HCSIS. EVV is not the source of truth when it comes to eligibility for a participant. You should continue to use the eligibility verification system to ensure that participants are eligible to receive services, and reference your authorizations received either from the service coordinator, supports coordinator, or the Community Health Choices Managed Care organization. And if for some reason that individual is not populating in the system, that does not mean that you should not provide services. We do not want EVV to prevent services from being provided that are necessary. You can always go back and make those edits later once the discrepancies are corrected. Another question here, how does a provider send back billing or void to fix a mistake in billing? So as I mentioned, there is a reference sheet for all of the error service codes that would populate in Promise. And then there is instructions for each of those error service codes on what steps the provider should take. So please reference that on the DHS EVV website. With that, we're going to gather some additional questions, so please hold on.
we have been receiving some questions regarding how a provider deletes and resubmits a claim and how that would affect EVV visit data. The claims process does not affect the actual visit data within the aggregator. So if you void a claim and then resubmit the claim, the voiding of the claim does not delete or void your visit data in our aggregator. They're two separate data systems. So basically, the visit data is maintained in our aggregator. The only way that visit data would in some way change is if, an all EVV system is communicating that there's been an update made to that visit and it overwrites that visit in some way, or updates the status of the visit, perhaps from an initial verified status to omit if it's determined it's an invalid visit. But the claim system and the EVV system are independent. They talk to each other, but by voiding data in one, it does not void or impact the data in the other.
Did receive a question regarding how to file an extension. If you need to file an extension, please go to the DHS EVV website, complete the extension form, and send it to the EVV RA box. We've received several questions regarding whether or not timesheets will work as verification if EVV will not, the EVV system is not functioning at the time. As we mentioned before, if the EVV system for any reason is not working or your worker is not able to clock in or clock out at a specific time, the backup plan should always be to manually enter that data whenever the system becomes available. And you do need to maintain hard copy documentation when that occurs. Providers do have the flexibility to choose how they want to implement that type of policy with their operations, and if that involves a timesheet system, that is up to the provider. Another question we received is what validation occurs? Is it strictly a technical data review, or is there a validation of GPS coordinates and submitted EVV hours versus billed hours? So a couple different levels of validation occur. First, EVV visits must have all the necessary data elements or an exception will populate. So if the GPS coordinates are completely missing, an exception will populate and that will need to be corrected since location is a required field mandated by the Cures Act. The Promise system is also validating against the EVV visit aggregator data for billed claims. So if claims do not have matching EVV visit data, error service codes will populate. They are currently in pay and list status, but as of July 1st, those scenarios would deny until the appropriate EVV visit data is supporting the claim. We received a question regarding what our protocol is if there were any sort of data breach with the EVV system. And we do have federally mandated requirements to report any data breaches when they occur. We would continue to follow those protocols as we would with any other data breach with a system. So we have received quite a few questions regarding incorrect authorizations that are received from the MCOs in Community Health Choices. If you're having any difficulties with authorizations or the HHA system itself in Community Health Choices, you do need to reach out directly to the managed care organization to resolve that. If you are unable to resolve that, you can reach out to the Office of Long-Term Living Provider hotline that was provided earlier in the slides. We are just consolidating a few additional questions, so we will be back in just a few minutes.
So we had a request to further explain what was displayed on slide 70. So we're getting back to that slide for everybody's reference. When we were discussing that providers should not be changing start and end times, that we want to capture true start and end times for visits, what we're seeing in our aggregator research for the visit data is captured is some agencies are changing every clock in and clock out to perfectly align with the schedule. It does not need to perfectly align with the schedule. What the expectation should be is if the direct care worker clocked out or clocked in at the incorrect time or missed it completely, then of course a manual correction or entry would be validated or would be appropriate. But if they've clocked in and clocked out at the correct time of their actual start of the visit, then we shouldn't be manipulating the visit start and end time simply to perfectly align with the schedule. That's not the intention of the EVV system. And the second statement, providers selecting other for reasons for manual edits should provide written reasons for selecting this. The selection of the reason other requires a mandatory memo to be supplied by the provider. So we're looking for an explanation as to why that change was made if it was not one of the predetermined drop-down other option menus. So we're expecting something that is written out. Sometimes we're seeing numbers being supplied, which mean nothing to us at all. So we're looking for a written narrative, something in text that explains why the manual edit was made.
So we received a question, so an agency uses cell phones that the agency issues to their staff that collects GPS location. They use these to call in for several individuals that they serve, since they do not have a fixed phone line or personal cell phone with GPS available in the home. And when they do this, they're having instances where they get a notification that they have an unmatched client ID or phone flag, and there's concern about whether or not this will inhibit claim submission or EVV compliance. It sounds like you are using the HHA exchange system for EVV in this scenario. If that is not correct, please send us additional information on what system you are using for EVV, but I do believe that this is the HHA exchange system, and if you're having difficulties with those types of errors, you need to reach out to your managed care organizations and HHA exchange so that they're aware of the errors and can assist with fixing them.
We had a question about where the extension form is for the good faith effort exemption, where it's located on the page, on the DHS EVV page. And while we can't pull it up on the screen to show you, it is included under the section on the main page, when will Pennsylvania implement EVV? You'll see that there's a link to the form under the January to March 2020 timeline, as well as the resource account information to submit that request. So hopefully that helps.
We received a question: if a participant's eligibility is bad, are we supposed to continue services? It is the provider's responsibility prior to rendering services to verify participant eligibility. If the participant is ineligible for your data service and you render the service, the provider agency is potentially liable for not being compensated for those services if eligibility is not reinstated for that service date.
Okay, so next question, will a client signature be required for every visit entry? So the Sandata EVV system does not require client signatures for EVV entries, as there is no standard requirement for that across all programs. That being said, participant-directed programs do require a participant signature, and the public partnership system does require a participant verification for all EVV entries.
As we previously discussed, if you're a provider agency that's currently using the DHS EVV solution as your EVV system, and you are interested in the billing module, at this time it is currently not fully functioning and operational, so you should not be utilizing the export functionality until we let you know that that is now available to you. We got inquiries related to required fields lacking. That's part of what we're resolving through our testing right now. So that's why we're please stating do not use the billing submodule within the DHS EVV solution until further notice. Thank you. We've received inquiries for those who have DHS EVV aggregator accounts on clarifying slide 57. So we're going to go back to that. There was a illustration of logging in to the SAN data aggregator. Basically, on the agency field, you just leave it in the default entry STX with no agency number following it, just simply STX, and then you would log in with your username and password, and that's what would give you access to the aggregator. We wouldn't completely omit the agency field. You would just not include a number for the agency, just keep it STX.
The next question we received was regarding clarification about rounding rules. EVV does not change program billing policies. So any rounding rules that were in place before the EVV system continue to remain in place, and they will not change.
We received the question, if a provider receives authorization after the fact, but the caregiver worked, how do we then obtain EVV? If the authorization is authorized after the service is rendered and the service is already delivered, then that would be a scenario where the visit would need to be manually entered. Of course, it's not being captured at the time of service delivery. So the provider agency would need to have supporting documentation that substantiates why that visit was manually entered, and the agency should wait until the authorization is finalized before they would submit their claim.
We received a question regarding what providers should do when they encounter GPS exceptions that they are unable to fix. So the only time in the SANDATA EVV system that a GPS exception would occur is if there is no GPS data. GPS data of some sort must be gathered for the visit, as it is a required field. However, as long as there's GPS information available, there will not be an exception generated if you are outside of the location proximity. So it sounds like in this particular circumstance, since GPS exceptions are generating, that you're using a system other than the SANDATA DHS EVV system. So you'll need to work with the vendor for that system to make those corrections. Bear with us, we are gathering some additional questions. So we received a question whether or not a signature is required if a provider is contracted with the managed care organization. Typically, the only programs that require a client's signature outright are the participant-directed programs. So the public partnership system will require a signature since the common law employer approves the time. However, if there are additional requirements in the CHC MCO system, you'll need to speak with the MCOs about those requirements.
We had a question as to whether or not there would be a response to the extension request forms that are submitted. This provider submitted a request and unfortunately never got a response. So if you are submitting a request form, you should receive a response back from the resource account. If you have previously submitted and did not receive a response, please go ahead and resubmit to the resource account, and we will make sure that it is reviewed and responded to.
Additional question or clarification has been requested on rounding rules. If my employee signs in 1 minute after the hour, will the provider be able to bill for that half hour? So this varies depending on program policy, as mentioned earlier. So the Office of Long-Term Living does require at least 7.5 minutes to be provided in order to bill for 1 unit. For the Office of Developmental Programs, additional guidance on rounding rules can be found in the technical guide that is on the DHS EVV website. So a provider states that they have several caregivers who do not own their own smartphone, and the clients they are serving do not have a landline. Although they state that a client's family member may have a smartphone, but they may not be at the home for every shift. So the question is, how are caregivers supposed to log in and log out? We open bring your own device system, and we are extremely flexible with what devices you can use. It can be owned by the participant or the family if they give you permission to use that device only. Or the client or your worker can own their own phone. However, ultimately, employers are responsible for ensuring that their workers have the supplies they need to complete their work. So you'll have to work on a case-by-case basis to make sure that the direct care worker has the proper devices to clock in and clock out. We are aware of some agencies who have chosen to designate a device between all of their workers that work out of a single home. They can clock in and out of the same device, so all of their workers share a device. But you will have to troubleshoot those types of issues on a case-by-case basis.
One of the questions we got is, can we start using Sandata, DHS's EVV, and then later transition to a potential third-party EVV solution? The answer to that is yes. The transition will need to be planned well. You'll have to have your alternate EVV solution not only implemented, but it will need to be certified by Sandata prior to switching over to utilizing that third-party EVV solution. But yes, a provider can change switching from the DHS EVV solution to an alternate EVV, as well as vice versa.
So we did receive some questions regarding whether or not we would be sending information directly to participants about the use of EVV. So for the participant-directed program in the Office of Long-Term Living managed by Public Partnerships, all common law employers did receive extensive information about the EVV requirement. But for the broader program, although many advocates and participants have been engaged throughout this process, we are proceeding with an open system, which means that every provider system could function slightly differently. So if a participant is resistant or asking questions about why a worker is using a device in their home or is unsure of why the worker would be asking to use their landline, providers should take the time to work with the service coordinator and the participant to understand these requirements. It's difficult for DHS to send out a communication that will make sense and accommodate every system a provider might use in the home and all the different ways that that could look to a participant. So we do rely on providers to explain this process to their participants if they have questions about the system you're using. The next question we received is, how is the signature of a participant captured for participant-directed services during each visit? So for the public partnership system, workers can gather multiple shifts without a signature. If the worker or the common law employer does not want to sign off every shift, that is up to them. They can sign off actively every shift, or if it is their preference, they can sign off for an entire week or 2 weeks payroll of time all at one time. They do not have to complete an individual signature during each shift, but they must at some point approve that time.
So we received a question about 2-to-1, the 2-to-1 services, and it is the 2-to-1 testing you mentioned on the previous slide. Does this apply to all EVV procedure codes that have the 2-to-1 staffing pattern? And the answer to that is yes. I believe there's 2 of them. There's respite. Respite has 2-to-1. And I think in-home, maybe in-home and community supports. So the answer to that is yes. It does apply to all EVV 2-to-1 services. And right now, I'm sure you all know this, because we're in the testing phase, right now anything 2-to-1 is bypassing that EVV validation against the aggregator. So it is not being, you know,
Not posting EVV edits on the claim.
no, it is not posting EVV edits. You will not see them, so that doesn't, it's just not, it's bypassing that function right now. And once the testing is over, that it'll start validating against the plan, and you will see ESC set or status code set. Yeah.
So next question, can the caregiver or direct care worker use the cell phone or landline phone of the client they are serving? Yes, if the client or participant gives permission for that device to be used. They do retain the right to deny use of their devices that they own.
Okay. So here's a question that came in regarding payers sending data to the, or providers sending data to the aggregator regarding services provided to an individual under the Bureau of Autism Services. They're asking if the payer code that's to be utilized for that service should be PA-ODP. The answer is yes. Bureau of Autism Services falls under PA-ODP.
And we will wait a few additional minutes for questions. If we have not answered your question, we will have to take it back to review with SAN data and provide a follow-up through our FAQ document. The next question we received is regarding the difficulty in completing EVV visits whenever the SAN data system is completing updates, and that it would require manual entries later on. So that is absolutely fine. You can complete manual entries when the system is updating. We do anticipate that system updates should provide advance notice, so you'll know when the system may be down for maintenance. However, there are always unexpected circumstances, especially as we are continuing to implement the system to where there might not be appropriate warning. And when you have those difficulties and that inconvenience, we do apologize, but you can continue with manually entering that information once the system is back up again.
All right, we want to thank everyone for participating today. We had some really good questions that came in. We will be updating the FAQs and posting those updated FAQs to the DHS EVV website. And hopefully that will be next week that you'll be able to find those. We also wanted to just mention that the next public meeting is scheduled for Friday, April 3rd from 1 to 3, and you can access the registration through the DHS EVV website. So please, if you intend to attend, please register through that link, and we will make sure to have another great discussion. Again, if you have any questions that are EVV related, specifically policy related, please send those to the resource account. And if you have extension requests that you would like to submit, again, submit those to the resource account as soon as possible. And thank you very much.